Okay, so lastly, we'll talk about another couple of antifungals and then some antivirals. So griseofulvin, otherwise known as fulvicin, is a drug that is being used. It's the only one, only systemically approved drug for the treatment of um, ringworm. So, and here is a typical kitty with ringworm. This is where it just tends to occur in cats. Um, Especially shelter cats, you'll see it around the ears, and then we can get it as well. So that's why we want to just, if you see it, just put those gloves on. This is developed from a mold, and if you remember, penicillin was a mold, was a fungus. So kind of interesting. So we use it to treat superficial fungal infections, but it is given systemically. It's given orally. So trichophyton, microsporum, these are two different types of ringworm. And ringworm gets into the hair and the nails and claws and hooves of animals. So the way that it works is it's taken up by growing dermatophytes, and it inhibits spindle formation and mitosis. If you remember the division of cells, basically the thing that it does is suppresses replication of the cells. The animal has to be able to then go in and finish the job. It's fungostatic. It's not really fungicidal. So when we give it, we want to give it with a fatty meal. We're going to give it orally, and it takes several weeks for it to work. There are powders, there's tablets of it, um, and the smaller the better. So there are micro-sized, and then there are ultra micro-sized. So we would prefer the ultra micro-sized if the owner can afford it. The reason why it takes so long is it will be absorbed in the lower layers of the skin, but it needs to then go through the progress of that skin does of getting to the top layers, and that takes a little bit where the dermatophytes are and interfere with it there. So it acts from within to treat something very superficial. And so it can get into the nails and into the skin, and so that is really good for treating it. It's metabolized by the liver, and because of that, and because it's conjugated with glucuronide, and this is something that cats do not have, cats will eliminate it much more slowly. So we need to decrease the dose for cats. There's different dosages for cats as for dogs or horses for that matter. So this is a test for one of the types of tests for dermatophytes, for ringworm. And you get these little bottles of the media that's been put in there on a slant. It just gives more surface area for it and so that you can see it a lot better. And these caps are on tight when you get them, but you pluck some hairs from the site and then open up the bottle and kind of push it into the media, and then you watch it. And typically what we would do is we'd put these in a cabinet to keep it from the light. And on the inside of the cabinet near where I had Tex put these, I would have just a piece of white tape. And each day someone would look at it and remark on whether they saw any kind of growths. And put the date. And so here are some white fluffy growths on this media. It's very important to look at it every day because the reason that we'll know that it is ringworm is if this media turns red within 24 hours of seeing the first little growth on it. So really important that once you get those going, someone is checking them every day to make sure of what you have. This can take 2 weeks. So usually we'll go ahead and start treatment if we think that it's a fungal infection. And I would say the azoles are used the most of the drugs, but sometimes griseofulvin is used. Um, it just, we can give it systemically, and sometimes, especially if it's very deep seated the in the uh, nail beds and things like that, it gets in there better than some of the topical azoles that we can use. So anyway, that is, and when we have it in this bottle, after we've put the sample in, we have to keep it loose because it needs to have air in order for it to grow, because the infection itself, the fungal infection, is growing in an aerobic environment on the surface of the skin. Griseofulvin is teratogenic in cats, so we want to not give it to any pregnant animals. Rarely we'll see anemia, leukopenia, bone marrow suppression. That's just not very common. More commonly, what we'll see is vomiting, anorexia, and diarrhea. Terbinafine is a drug that we see more in human treatments, and we'll see it for treating toenail fungus in particular. And we can give it for fungal infections in toenails or claws, I should say, and hooves, but we have to give it orally. If we just have a superficial ringworm infection that's not affecting the hooves or the nail beds, we can give it topically. We can just put it on. Its mode of action is similar to the azole antifungals, and side effects are similar to GI upset and hepatotoxicity. So lastly, I'm going to talk a little bit about antifungals. We don't have a lot of these drugs, um, and there aren't any that are approved, but typically where these have been used is more in cats than in larger animals. They still are relatively expensive, and it seems like the main viral infections that we're trying to treat are in cats. So we have some that are used topically, some that are used systemically. We don't have a lot of research on these antifungals either. So acyclovir or famciclovir, it's used in Pacheco's disease in birds, in small animal clinics. We see it used a lot with feline herpes virus infections. So feline herpes virus is a very common virus that gets spread in shelters and with young kittens that are exposed to it. And herpes viruses tend to stay in the body. And when an animal is stressed, we see what's called a flare. It will cause some kinds of signs. It may change over time. And originally, the original infection will cause probably the biggest clinical signs, and then if the animal survives it, then the virus kind of goes dormant, and then, like I said, if an animal is stressed, then this will trigger the flare of it. And typically in cats with herpes virus, it affects the cornea and conjunctiva in the eye, and we can get photophobia, we can get vascularization of the cornea, so blood vessels growing across the cornea, the animal will not be able to see. And so this is a treatment to help reduce the viral load in an animal that's having a flare. We can get some leukopenia and anemia with these drugs. Idoxuridine is a topical, comes in eye drops, and it's again used to treat feline herpes virus corneal infections. So I had a kitty that had feline herpes virus, and so whenever some kind of stressor would happen in our household, we might have guests. I had it happen after we left town, and we had a house sitter take care of the cats. And so he was on acyclovir and idoxuridine. because he did start to get vascularization of his cornea. These are relatively expensive, but in a cat, it's not that expensive to treat them. Interferon is a drug that's been around for a long time, and now we have generic forms, so it's not as expensive as it used to be. So you'll hear it being used for treating a variety of viral infections. The main ones that we'll see are treating feline leukemia virus, the type that is non-neoplastic, so where we do not have cancer in the animal, we can use to treat the signs of feline leukemia virus and associated diseases, or associated disease, I'm sorry, with the feline leukemia virus. Lysine is an oral supplement that you can find in the drugstore back near all the vitamins and everything. And it's also sold generically over Amazon, and in some vet clinics will go ahead and purchase it and have it on hand. It is one that you can just put in the food on a daily basis. An owner can do that with a cat with feline herpes virus, and it will help to decrease the shedding that then causes the signs of the viral diseases. So that one is relatively cheap and easy way to treat it. So we don't have a lot of antivirals. As time goes on, we'll probably have more and more of these. As you can tell, I focused mostly on treatment of eye symptoms in cats with feline herpes virus, because the other thing about them is when new ones appear on the scene, they're fairly expensive.